twisted your ankle a few months ago. It might have been during exercise, sports, playing pickleball, and the ankle still doesn't feel right. It might be a bit swollen, painful, or unstable when you're walking on uneven surfaces or up and down the stairs. What could be wrong with your ankle? I'm Dr. Tan Ken Jin. I'm an orthopedic surgeon and I specialize in ankle and foot injuries, and I practice at Mount Elizabeth Novena Hospital. What are the ankle ligaments? The ankle actually is surrounded by many ligaments, and these two outer ligaments, this being the ATFL and this being the CFL ligaments, are the most commonly injured ligaments. These ligaments help provide stability for our ankle and foot, for sports, for walking on uneven surfaces, and for start-stop movements as well as impact exercise such as running. Injuring your ankle is one of the most common injuries that can occur to anyone. Typically, our ankle is injured in a plantar flex, which means pointing down position, and it rolls inwards. So the outer ligaments are sprained or torn. How do we differentiate between a normal sprain and something more? Typically, a sprain will recover quite quickly within maybe 2 or 3 days. There will be not much swelling, not too much pain. When there's a tear, typically the ankle is a lot more swollen, a lot more painful. Bruising, that means a blue-black appearance from internal bleeding due to the tear, appears on the outer aspect of your ankle. These would suggest a tear rather than an ankle sprain. When to seek help after an ankle injury? This could be early on if the injury is quite bad and it's hard to walk on, very swollen. You should seek early help. The other time you may seek help if a month or two after the original injury, the ankle feels still swollen, painful, or may not feel stable. In that scenario, good to seek some help too. Typically, when we see patients with an ankle injury, we would like to see what the gait pattern is like. We'll palpate around the ankle ligaments and bones around the ankle. Your doctor will typically do some stress tests by pulling on the ankle to see how stable the ligaments are. If we suspect a little bit more, then we might generally recommend some imaging. Most of the time for ankle ligaments, an MRI scan will be the best way to visualize the ligaments and see the extent of injury. So how would your doctor decide what to do and how to treat your ankle injury? First, we look at the type and extent of injury. This typically is seen on clinical examination and an MRI scan. If more than one ligament is torn, for example, that would signify a more serious injury. The other thing we look at is the person, someone of a medium to higher activity level, would benefit more from some sort of surgical repair versus conservative treatment. Surgical repair of ankle ligaments, otherwise known as the Broström procedure, is one of the most common surgical procedures. Typically, it is fairly easy to do. After the surgery is done, which takes about 30 minutes to 40 minutes, you would wake up with an ankle brace. We would then do some walking with the physiotherapist using the brace, and most patients are able to weight bear and walk on the ankle immediately after and are then able to be discharged the same day. The technique we use for repair of ankle ligaments is a keyhole, which means arthroscopic surgery, where it allows us to visualize the ankle ligaments, repair them with an internal brace. During the surgery, a small incision is made and a camera is put into the ankle to look for the torn ligaments. Most of the time, we are able to find the torn ligaments, and a small suturing device such as this is used to suture the ligaments. They are then reattached to their attachments with small tiny plastic pins like these. We can also use a version which dissolves away with time. Typically, after the surgery, you are able to walk with an ankle brace, and the brace is used for about 3 weeks. So if you've injured your ankle some time ago and it's still causing you problems, it's important to seek treatment. A lot of the time, the continued symptoms might be because there was an ankle ligament tear that has not healed properly. If that's the case, it's easy to treat, particularly if you opt to repair it. We nowadays do more and more repairs, not only for younger and very sporty people, but also people who are in middle age or older who wish to remain active, play sports, travel, go hiking overseas, etc. Typically, someone who has undergone a repair of an unstable ankle will have a 10-year risk reduction of further sprains and complaints in the ankle, and thus it's a very effective procedure to solve your problem. So if you have any questions about the treatment, diagnosis, or the surgery, or you're having problems with your ankle, feel free to reach out to us.